I care about making a difference in rural Kentucky because rural Kentucky is me. It's what raised me. It's where I came from. It's where my family's always been.
Especially in rural Kentucky, communities are welcoming. They want to reciprocate the love that you give them. I think that the heart and soul of this state is in rural communities.
But it's such a deep and complex place with many different cultures and outlooks.
Rural medicine has always been important to me because growing up in Jackson, I got to see, unfortunately, the health disparities that ravage the community there. And I just knew I wanted to be a part of the catalyst that was going to bring the change back to Eastern Kentucky.
I chose to pursue rural medicine because I saw how a lack of healthcare representation around the state could negatively impact patients and their families. Coming from a rural area, I firsthand witnessed this, and I decided that I wanted to try to make a difference.
And so I do believe that is my calling, to go back and help those that are often overlooked.
I want to give back to them what they've given to me.
The healthcare of those people that live there is especially important. It's part of me, I guess.
The RPLP program, also known as the Rural Physicians Leadership Program, is a program that is centered in Moorhead, Kentucky, and it allows students who are interested in practicing rural health and being a rural health physician later on in life to come to Lexington for their first 2 years to learn with the other students in the Lexington campus, and then for their last 2 years travel back to Moorhead at St. Clair Hospital and get the hands-on skills that you may miss in a bigger community.
The mission of this program is to provide more physicians in the underserved areas of rural Kentucky.
Health outcomes in Kentucky are not always what we would hope, and it is a challenge, one that we are able to address and that this program is specifically designed to help address.
RPLP is a wonderful pipeline program that we've taken local students, put them through the wonderful University of Kentucky College of Medicine's curriculum, and have now passed them on to the collaborative St. Clair and UK Family Medicine program.
And you get that best of both worlds feel where it's a family-like environment with top-notch education. I felt like being in Moorhead was like being back home in Breathitt County.
I did my undergrad here. I came and I instantly felt this, it was like it was home. I can walk up and down the streets, people smile at you.
The thing that I've enjoyed about the Rural Physician Leadership Program is the connections that you form with your patients as well as the people that you're working with every day. Moorhead is a very welcoming community.
The greatest thing about RPLP is the relationships. I think that's what people love about small towns. That's what they love about Appalachia, and that is what RPLP can bring to the healthcare profession. It's a small program. Students get to work one-on-one with their preceptors. They also get to engage patients and community members, and they get to form close bonds with each other. So this is truly a unique experience for our students.
I've loved my experience in RPLP. I've gotten to work with physicians one-on-one. I'm right next to the physician when we're in the OR, whether we're in the clinic or whether we're doing procedures in the emergency room.
Yeah, so we've absolutely had the best of both worlds. We got to go those first 2 years in Lexington and have access to the same resources that everybody gets at the best healthcare institution in the state.
So through RPLP, I'm hoping to go into primary care. I think that we need a lot of primary care physicians in rural communities, which is where I ultimately want to go.
I care very deeply about increasing the diversity and the openness in rural Kentucky and in rural medicine. I don't want anyone to be turned away or feel like they are less than. If someone were to have a heart attack in Maysville, it shouldn't be a death sentence. So I hope to go back and be a cardiologist and address that.
I really feel like my teachers have prepared me for whatever's going to come. I'm not going to say that I won't face challenges along the way, but the lessons that they have taught me and all of the things that I've experienced along the way, it'll get me through it. I hope that I leave the world a better place than how I found it.
When I finally am able to walk across that stage in 3 years and get that diploma for my MD, I am so excited to go back home and give the care that is so much needed in my community and be the best physician I can be for the people who need it most.